Hi, I'm Dr. Nancy Grubb. I am a medical doctor who does integrative medicine, and my patient here.
Well, tell us about you first.
Oh, okay. What else do you want to know?
Well,
Okay. Well, I'm here because Vlad flew in to do some treatments on my patients.
But before that, at the conference, I did a treatment on you.
I was getting there.
Sorry. Go ahead.
That's okay. That's okay. But the reason I had Vlad come in with the Atlas Prophylax is I was at a conference for End Pain, and I had met him there when they were doing. Actually, it was the first lecture of the End Pain on migraine, headaches, and structural, and he had given his talk on how this permanent fixation of the neck or the muscles was going to fix everything, and he had a long list. I don't know, I'm a medical doctor, so I listened. I didn't have anything wrong with me, but before I do anything on my patients, I have to try it first. And he was offering it for the attendees. So I did have it done. To my surprise, my TMJ was gone the next day, and I didn't expect it. So from that experience, I came back, and I was telling everybody about it. Fast forward 6 to 8 months, I'm seeing various individuals. I had an office staff member who needed some help, and she sought out treatment by your sister in New York City and had some great results. And then we invite him to come here because I'm seeing with my patients the same thing. And he had taught me how to look for instability, shoulders off, maybe neck range of motion. Ann Haas is a patient I was seeing for other things, and we're in conversation. She's telling me about her hand, her arthritis, needing cortisone injections, not wanting it. Anne is a very active individual. You want to tell them what you found?
I'm coming up for 66. I work out a lot, insanity classes. I do a lot of small group training, kind of crazy things, mud runs. And I want to stay fit, but I felt as though my body was breaking down, and every time I went to a doctor, they sent me to a specialist, and that specialist would say, well, you know, at your age, we can give you cortisone, which I refuse to have, or take this, or just keep pumping Advil. I was given one painkiller, which when I read about it, they'd had a recall on it. Oh, wow. I wasn't filled with confidence. It's pretty much slice and dice, and I just felt there had to be an alternative. And so, having a great relationship with Dr. Grubb, I trusted her when she said, just seen this guy and you've got to try it. So this morning we came in and I was waiting, and one of the last patients, we were talking about my hand was just hurting so much, stinging as though rubber bands were hitting it. And we did the test of strength, and I had none. And I then had the treatment and came back out. And
take a look at this. Watch this. And truly, it just before her finger went through. But now, okay, now let me do that. I can't even get it through. That is strong. That is strong.
And how are you feeling overall?
Good. I mean, I couldn't turn my neck completely.
Let me see the range of motion now. It was very limited before, huh? Look at that.
Almost like the owl.
Almost perfect. Very nice.
Next fighter pilot.
Great.
So I'm very excited to keep going. The advice is just keep doing what you're doing, because I want to die fit if it kills me.
No, you're doing great. Thank you so much for sharing your experience.
Welcome.
Thank you.